Very good morning to the dignitaries on the dais and my dear friends and students. I have been the privilege of introducing you to the theme of the conference we are having, and it is a real proud privilege for me, because today when I am speaking from here, I am not speaking as a dean or an administrator. I am speaking as a doctor who has worked in close association with the nurses, and I know the joys and the sorrows of this profession. And today I think we have the distinguished speakers who will be trying to balance this joys and the sorrow with their talks on spirituality and how do we conduct and how we maintain the balance between the two extreme emotions, which may positively or negatively impact our life. Now let us see, being in a nursing profession, what is the positive points? I think the positive point is you touch the life whom you come across as patient and their relatives. And I think that is the biggest achievement you can have. You may make money, you may do a monument, you may give charity, but ultimately at the end of the day what you remember is somebody who has touched the heart. And I think this is one profession where you can touch the heart directly and not through an indirect means. What are the negative points? The negative points where I feel today we need support from this foundation of Brahma Kumaris, where they try and teach us how to balance this, is that you are surrounded by the negative feeling. There is no patient who comes to you with the happiness and a smile on his face. They come to you with agony, sadness, anxious relatives, and all the time you are surrounded with the negativity. And we know, like the law of physics, that when you are surrounded by a negative energy, you also tend to become negative. But here is a paradox, that you are surrounded by a negative energy, but you need to be positive and you need to impart this positive energy to your patient. How you are going to do that when you are surrounded by negative? And this is where today's theme of topics is, which is going to help us, that in spite of this negativity, how do we charge ourselves positive? Not only we are positively charged, we impart this positive energy to your patients and relatives. Mind you, as an experienced doctor, I can tell you that you may heal the body, but unless you heal the soul and the mind, it's not going to work. And this is where that positive energy, you may have all the skills, but this positive energy which you're going to impart to your patient and their relatives makes them really well. The second point, a negative point, or I say challenging point as far as the nursing profession is concerned, is that, you know, we are always excited by the good senses. That's why we have flowers, we have aroma, things like that. But you are working in an environment which is full of, something which offends your sensory organs. But you don't have to react negatively to it, because the patient would not like it, and that's not the right way of doing it. The patient is suffering. So in spite of this negative sensory organs, you have to maintain a very positive balance. This is again very equally important in your profession. Long unpredictable working hours. Sometimes you may have a demanding doctor, which is a truth. I have been a doctor. I know when I am in a stress, sometimes it may be possible that I take that stress on my nurse, but the nurse has to be very efficient, calm and cool, which is a very great quality in a nurse which you have to cultivate. Facing very angry patient, this is also possible, because you are not God. Many a times, in spite of all your best effort, things may not go as it should. And then how do you deal with that? That is a quality. And here reacting because somebody talked to you in anger does not help the situation. So we have to remain calm. And how do we maintain this calm in spite of a very negative, very hostile environment? This is something today we will be learning. How to balance a career and home also is equally important. And this is the thing which as a nursing profession we have to learn. And I really compliment all the students that in spite of all this demanding profession, you have chosen this profession. You are intelligent enough, you could have gone for any profession, but you chose to come to a nursing profession, talks about the inner spirituality in you, which is inherent in you, and therefore you chose this profession. And today's talk will help you in honing this quality which is already inherent in you. I thank the management that they thought about this, and they have always encouraged us. This institution, if you see, it is not only for the skill development, training, knowledge, it also cultivates the inner personality in you. They have cultural festivals, appreciation of art, music, dance, etc. So it brings the total personality in you as a person. So we want professionals, but we also need creativity. So our personality really blooms, and that is what the Somaiya management has already done. I thank Madam Kanyakumari and Avani for having this theme, because they understood this inner spirituality has to be blossoming out in our student, and this is the right time, not after you go into your clinical experience and field and then you start facing the problems. This is the right time to learn all these aspects, and I thank them and I compliment them for having this kind of a conference for the nursing students. Last but not the least, you have to live your life. Please live your life not by default but by design. And every day is important. It's very easy for us to say, today is fine, I will go with the stream, and tomorrow I will think I'll make my life, but the day is gone. I want to share a small poem which is very dear to my heart, and I tell this to all my students because today is the day you have to live, not after 10 years. This day is never going to come back. So the life should not become like a work, it should become a place where you can enjoy yourself. And this poem is about the irony of life. It says, first I was dying to finish high school and start college. Then I was dying to finish college and start working. Then I was dying to make money, marry and have children. And then I was dying for my children to grow up old enough so that I could go back to work. But then I was dying to retire. And now I am really dying, and I suddenly realized I forgot to live. I think this should not be the story of our life. You do well in your studies, you develop your skills, but don't forget to live. And this is again a very important message today which we are going to learn during our course of the day. Thank you very much, and with this I open the conference. Have a good time, have fun, enjoy, imbibe all the things which are told to you, and you may take many, you may discard few, that is fine, and that is the way you have to live. Thank you very much.